Well, 15 years ago today, Congress abandoned the Clinton health care reform effort, and yet the fight for reform goes on. President Obama still faces many of the same obstacles that plagued then-President Bill Clinton. So can he succeed where Clinton failed? Who better to ask than the people at the White House at the time back in 1994. Our panel today, Health and Human Services Secretary under President Bill Clinton, that being the lady right there, Donna Shalala. Also, Harold Ickes, then President Clinton's Deputy Chief of Staff, and Kenneth Thorpe, who worked on the health care reform bill for the Clinton administration. Everyone, I do want to welcome you to the show. Thanks for being with us today. Donna Shalala, let me start with you. 15 years ago, this bill did not pass. Why not?
Well, there are a lot of reasons. Everything in politics is timing. It was a complex bill. We had trouble explaining the bill. We didn't have the kind of transparency that we have today. Everyone that had one problem with the bill got together with someone else who had one problem with the bill, built a negative coalition, and at the end of the day, we couldn't either explain it or put the politics together to pass it.
Yeah, if you can't explain it, how are you going to sell it? That's a major problem there. Harold Ickes, let me talk to you. Was it a design issue?
No, I don't. Well, I think it's partly a design issue, but I think Donna put her finger on it. We spent much more time on the substance of health care reform as opposed to the politics of how we are going to get it enacted. It strikes me that one of the lessons learned by the Obama administration is to pay much more attention to how to get this thing passed as opposed to the substance. That's not to say the substance is to be dismissed. It's very, very important. But the politics of getting this to get passed is, I think, the most critical. Another lesson learned, it seemed to me, is to try to bring some of the potential opposition in. I think the administration has done a very good job on that. And finally, it was not a transparent process, and is much more transparent this time.
Kenneth Thorpe, you actually helped write that, and it didn't even get out of committee, correct?
Well, that's right. If you look at today, we have four committees have reported a major health care bill out. 16 years ago, no committee reported any bill out. So the contrast, I think, in terms of where we are in the process is quite dramatic.
Well, do you think, Donna Shalala, let me go back to you, that President Obama's plan, at least when we figure out which of these bills is going to be the one, has a better chance of getting passed because there has been so much public debate, town halls and whatnot, public, forums out there discussing it and getting the information out there?
I do. I also think the situation today is much more critical. A much larger number of people without health insurance, and the costs have gone up dramatically. We have to both get the coverage and start to squeeze down on the cost for health care.
Mr. Ickes, do you think also because we are in a recession that we're seeing a greater importance placed on a health care reform bill?
Well, the answer is yes. The recession also brings other problems about how are you going to finance it. And there's been a great deal of focus on how to pay for and how to finance. The president has said he's not going to increase the deficit by one dime with health care reform. So financing is one aspect. There's the whole other aspect of what I would call, and I think Ken and Donna would call, real health care reform. That is increasing or having better outcomes, which is something that sort of gets lost in the shuffle on this in terms of the financing and the politics.
Let's talk a little bit about the details of the plan that the president wants passed. Mr. Thorpe, you helped write the Clinton bill that did not get passed. What are some of your concerns or some of the things that you actually like about the bills that are being tossed around right now?
Well, I like two things. One is that I think that the proposals are taking head-on to two problems that Donna Shalala mentioned, which is the high cost of health care, and this would be a proposal that covers the uninsured. I think it's affordable. The president has said that he wants to spend about $900 billion over the next 10 years, so the proposals in the Senate are fully paid for. And what I like, which is very different than 16 years ago, is that the scale of the problems are so severe today that everybody who really opposed health care reform 16 years ago, the health insurance plans, the pharmaceutical companies, hospitals, the health care providers in general, are all on board trying to pass this because they see the magnitude of this problem is so substantial that we really do need to have a comprehensive national solution. So I think if I'm looking at the tea leaves, I think things are lining up very favorably because everybody who could kill it and did kill it 16 years ago is still at the table negotiating, and we continue to move ahead.
So you think the climate is just ripe for some kind of reform to come out of this? Ms. Shalala, let me ask you, when it comes to the details of this bill, the president has really been pushing for a public option. Is that going to be what makes or breaks this bill? And what do you think about the public option?
Well, I like the public option, and I do understand the insurance company's objection to it. It's hard for them to compete against a plan that's run so efficiently, that doesn't pay executives a lot of money, that doesn't have to produce profits. And so I like the idea of the private plans competing against a base plan. But I'm not sure it's going to pass at this point in time. But there's no question that we have to hold the insurance industry, the pharmaceutical industry, all the parts of the system accountable. The public option is a very good way to do it, but I'm not sure the politics are there for it at this time.
And Mr. Ickes, I'm going to let you round out this. What do you think? What's your reaction to that?
Well, I generally agree with Donna. I think we should have a public option for the reasons that she stated. I think the important thing to understand, however, this is a big freewheeling system here. We've got $2.5 trillion, nearly 1/5 of the economy. People say we've got to rush this through. I think the Congress has done a very good job on it. The single most important thing is not whether the reform bill has X or Y or Z in it. There have to be certain key elements in it, and I'm sure there will be. The most important thing is to get something done, to drive a stake in the ground, to start changing the prism through which we start going forward talking about health care. That will be the critical element.
Well, there definitely is. We're looking at some of this video right now. A lot of talk going on, a lot of discussion, a lot of debate, and some of it very heated. It's an issue that people are taking very seriously. Donna Shalala, Harold Ickes, Kenneth Thorpe, thanks so much for your time and your insight today. We do appreciate it.
Thank you.
Well, you know, we police ourselves. We have an ethics committee. Do you know who the head of the ethics committee was? Tom DeLay. Woo! That's kind of like having Jack the Ripper heading Benihana. Scary thing that we're handling our own ethics. Yes, you are. In many ways, you are. Mr. Abramoff. Yes, sir. The checks are coming through. Checks are coming through. It's not a lobby. It's an entire hotel. They're just waiting there to buy people up, influencing people. But here's the drill. Poor people don't have lobbyists. They have advocates. They have people out there saying, but the main thing about Washington, the plasma that runs Washington, is money. Lots and lots of cash. Money. Lots and lots of cash.